10 shocking prediabetes signs you must know before it is too late. Prediabetes is a condition that often goes undetected, yet it serves as a critical warning sign for the development of type 2 diabetes. By recognizing these signs early on, you can take proactive steps to prevent or manage prediabetes and protect your future health. In this video, we will uncover the 10 shocking signs of prediabetes that you must be aware of. These signs can manifest in various ways, affecting different aspects of your body and overall well-being. By understanding these warning signals, you can empower yourself with the knowledge to take control of your health and make informed decisions. Whether you're someone who wants to be proactive about your health or you know someone who may be at risk, this video is for you. By the end, you'll have a comprehensive understanding of these 10 signs and how they relate to prediabetes. We'll provide you with valuable insights, practical tips, and actionable steps to help you stay ahead of the game. Our goal is to provide you with the tools and knowledge you need to live your healthiest life. Knowledge is power, and with the right information, you can protect yourself and your loved ones from the potential risks associated with prediabetes. Just a quick reminder, this video is for educational purposes only, so speak to your doctor if you have any medical concerns. So, without further ado, let's dive into the 10 shocking prediabetes signs you must know before it is too late. Stay tuned, take notes, and let's take charge of our health together. 1. Frequent urination. Frequent urination refers to the need to urinate more often than usual. If you find yourself experiencing this, particularly during the night, it could be an indication of prediabetes. Prediabetes is a condition where blood sugar levels are higher than normal, but not yet high enough to be classified as type 2 diabetes. When blood sugar levels are elevated, it can lead to excess urine production. Normally, the kidneys filter waste products from the blood and reabsorb the necessary fluids and nutrients back into the body. However, when blood sugar levels are high, the kidneys may struggle to reabsorb all the glucose, resulting in increased urine production. This process is known as osmotic diuresis. The excess urine production leads to the need for more frequent trips to the bathroom. Individuals with prediabetes may notice that they have to urinate more often during the day and even during the night, disrupting their sleep. This symptom occurs because the body is trying to eliminate the excess glucose through urine. It is important to note that frequent urination can also be a symptom of other conditions such as urinary tract infections or an overactive bladder. Therefore, if you are experiencing frequent urination, it is recommended to consult a healthcare professional for a proper diagnosis. They can perform tests to determine if prediabetes or any other underlying condition is causing this symptom. Early detection and appropriate management of prediabetes can help prevent or delay the onset of type 2 diabetes. 2. Increased thirst. Increased thirst is a common symptom associated with prediabetes. Prediabetes is a condition characterized by higher than normal blood sugar levels, but not yet reaching the threshold for a diagnosis of type 2 diabetes. When blood sugar levels are elevated, the body tries to remove the excess sugar by increasing urine production. As a result, more fluids are expelled through urine, leading to dehydration. Dehydration is a condition where the body loses more fluids than it takes in, and this can trigger the sensation of thirst. The body's natural response to dehydration is to signal the brain that it needs more fluids. This signal is interpreted as an increased feeling of thirst. People with prediabetes may find themselves feeling excessively thirsty and having an ongoing need to drink fluids to quench their thirst. Increased thirst, also known as polydipsia, is the body's way of trying to maintain proper hydration levels. However, it's important to note that excessive thirst can also be a symptom of other medical conditions or lifestyle factors, such as certain medications, high-intensity physical activity, hot weather, or excessive salt intake. Managing prediabetes through lifestyle changes, such as a healthy diet, regular exercise, and proper hydration, can help regulate blood sugar levels and alleviate the symptoms of increased thirst. 3. Unexplained weight loss or gain. Unexplained weight loss or weight gain can both be associated with prediabetes, a condition characterized by higher than normal blood sugar levels that have not yet reached the threshold for a diagnosis of type 2 diabetes. Sudden weight loss, despite maintaining your regular diet, can be a symptom of prediabetes. When blood sugar levels are elevated, it can lead to increased urination and subsequent fluid loss. This excessive urination can result in unintentional weight loss. Additionally, if the body is unable to properly utilize glucose for energy due to insulin resistance, it may start breaking down muscle and fat as alternative fuel sources, leading to further weight loss. On the other hand, some individuals with prediabetes may experience weight gain. Insulin resistance, a hallmark of prediabetes, occurs when the body's cells become less responsive to insulin, a hormone that helps regulate blood sugar level. When insulin resistance occurs, the body compensates by producing more insulin, which can lead to increased fat storage. This can result in weight gain, especially around the abdomen. It's important to note that weight loss or weight gain alone may not be definitive indicators of prediabetes, as they can be influenced by various factors such as diet, physical activity, and other underlying health conditions. 4. Fatigue. Fatigue, or feeling excessively tired and lacking energy, can be a symptom of prediabetes. Prediabetes is a condition characterized by higher than normal blood sugar levels that have not yet reached the threshold for a diagnosis of type 2 diabetes. When blood sugar levels are elevated, the body's cells may struggle to efficiently utilize glucose for energy due to insulin resistance. Insulin resistance occurs when the cells become less responsive to the effects of insulin, a hormone that helps regulate blood sugar levels. As a result, glucose cannot enter the cells effectively, leading to a decreased supply of energy for the body. The inadequate utilization of glucose can cause feelings of fatigue and low energy levels. Even after getting enough sleep and following a regular routine, individuals with prediabetes may still experience persistent tiredness and a lack of vitality. Furthermore, prediabetes can contribute to other factors that may also contribute to fatigue. For example, prediabetes can lead to disrupted sleep patterns due to increased urination during the night. Poor sleep quality can exacerbate feelings of fatigue and contribute to daytime tiredness. It's important to note that fatigue can have various causes, including other medical conditions, lifestyle factors, stress, or inadequate sleep. Therefore, if you're experiencing persistent fatigue, it is advisable to consult a healthcare professional for a comprehensive evaluation. They can assess your symptoms, perform relevant tests to check your blood sugar levels, and determine if prediabetes or any other underlying condition is contributing to your fatigue. Early detection and management of prediabetes can help improve energy levels and overall well-being. 5. Slow healing of wounds. Slow healing of wounds, such as cuts or sores, can be a potential sign of prediabetes. Prediabetes refers to a condition in which blood sugar levels are higher than normal but not yet high enough. to be diagnosed as type 2 diabetes. When blood sugar levels are elevated, it can negatively impact the body's ability to heal wounds effectively. High blood sugar levels can lead to several complications that hinder the healing process. One of these complications is damage to the blood vessels, which reduces blood flow to the affected area. Adequate blood flow is crucial for delivering oxygen and nutrients to the wound site, promoting healing. However, impaired blood flow due to elevated blood sugar levels can slow down this process. In addition, high blood sugar levels can also affect the immune system's response to infection. The immune system plays a vital role in fighting off bacteria and other harmful microorganisms that can cause infections and wounds. However, when blood sugar levels are uncontrolled, the immune system may be compromised, making it more challenging to combat infections and prolonging the healing process. It's important to note that slow wound healing can be influenced by other factors as well, such as poor circulation, nutritional deficiencies, and underlying health conditions. Therefore, if you notice that cuts, sores, or wounds are taking longer than usual to heal, it is recommended to consult a healthcare professional for a thorough evaluation. They can assess your symptoms, perform tests to measure your blood sugar levels, and provide appropriate guidance and treatment if prediabetes or any other underlying condition is identified. Managing blood sugar levels and supporting wound healing through proper care and treatment can help promote timely healing and prevent complications. 6. Increased hunger. Increased hunger, also known as polyphagia, can be a symptom of prediabetes. Prediabetes refers to a condition where blood sugar levels are higher than normal, but not yet high enough for a diagnosis of type 2 diabetes. In prediabetes, the normal functioning of insulin, a hormone that helps regulate blood sugar levels, can be disrupted. Insulin plays a crucial role in facilitating the entry of glucose from the bloodstream into the body cells, where it is used for energy. However, in prediabetes, the cells may become less responsive to insulin, leading to a condition known as insulin resistance. Insulin resistance can cause difficulties for glucose to enter the cells effectively, which can result in higher levels of glucose circulating in the bloodstream. The body interprets this as a signal of insufficient energy supply to the cells, leading to an increased sensation of hunger. Additionally, when blood sugar levels are not adequately controlled in prediabetes, it can lead to fluctuations in energy levels. After consuming a meal, the body processes carbohydrates into glucose, which is released into the bloodstream. In a healthy individual, insulin helps transport this glucose into the cells, providing them with energy. However, in prediabetes, this process is impaired, and the cells may not receive enough glucose for energy. As a result, the body may signal hunger even shortly after a meal, as it tries to compensate for the perceived lack of energy. It's important to note that increased hunger can also be influenced by other factors, such as lifestyle, emotional factors, or certain medications. If you're experiencing persistent or excessive hunger, it is advisable to consult a healthcare professional for a comprehensive evaluation. 7. Blurred vision. Blurred vision can be a symptom of prediabetes. Prediabetes is a condition characterized by higher than normal blood sugar levels that have not yet reached the threshold for a diagnosis of type 2 diabetes. Elevated blood sugar levels can have an impact on the lenses of the eyes, which are responsible for focusing light onto the retina, allowing clear vision. When blood sugar levels are uncontrolled, the excess glucose can cause the lenses to swell, leading to temporary changes in vision. The swelling of the lenses can result in blurred or distorted vision, making it difficult to see objects clearly. This effect on vision is often referred to as diabetic or hyperglycemic retinopathy. It's important to note that this vision disturbance is typically temporary and may fluctuate throughout the day as blood sugar levels fluctuate. It's essential to manage blood sugar levels to prevent long-term damage to the eyes. If left untreated, prolonged high blood sugar levels can lead to more severe eye complications such as diabetic retinopathy, cataracts, or even vision loss. 8. Tingling or numbness. Tingling or numbness, particularly in the hands and feet, can be a symptom of prediabetes. Prediabetes is a condition characterized by higher than normal blood sugar levels that have not yet reached the threshold for a diagnosis of type 2 diabetes. One of the complications associated with prediabetes is peripheral neuropathy. Peripheral neuropathy refers to damage or dysfunction of the peripheral nerves, which are responsible for transmitting signals between the central nervous system, brain and spinal cord, and the rest of the body. Elevated blood sugar levels can contribute to nerve damage, resulting in symptoms such as tingling, numbness, or a pins, and needle sensation typically in the hands and feet. The exact mechanism behind how high blood sugar levels lead to peripheral neuropathy is not fully understood. However, it is believed that prolonged exposure to elevated glucose levels can cause damage to the blood vessels that supply oxygen and nutrients to the nerves. Additionally, it may directly affect the nerves themselves, interfering with their normal functioning. The tingling or numbness experienced in prediabetes. Related peripheral neuropathy can vary in severity and may come and go or be persistent. It is important to note that peripheral neuropathy can also be caused by other factors, including other medical conditions, certain medications, or even nutrient deficiencies. 9. Recurring infections. Recurring infections, such as urinary tract infections, yeast infections, or skin infections, can be associated with prediabetes. Prediabetes refers to a condition where blood sugar levels are higher than normal but not yet high enough for a diagnosis of type 2 diabetes. Elevated blood sugar levels can have a detrimental effect on the immune system, the body's defense mechanism against infections. When blood sugar levels are uncontrolled, it can weaken the immune system's ability to fight off bacteria, viruses, and other harmful microorganisms. The immune system plays a crucial role in identifying and eliminating pathogens that enter the body. However, high blood sugar levels can impair the function of immune cells, reducing their efficiency in combating infections. This weakened immune response can make individuals more susceptible to recurrent infections. Common infections that may occur in individuals with prediabetes include urinary tract infections, UTIS, yeast infections, such as vaginal yeast infections in women, and skin infections. UTIS can occur when bacteria enter the urinary tract, leading to symptoms such as frequent urination, pain or burning during urination, and a persistent urge to urinate. Yeast infections can develop when there is an overgrowth of yeast in certain areas of the body, causing symptoms like itching, irritation, and abnormal discharge. Skin infections, such as fungal infections or bacterial infections, may also occur more frequently in individuals with prediabetes. It's important to note that recurring infections can have various causes, and prediabetes is just one potential factor. Other factors, such as poor hygiene, weakened overall health, or other underlying medical conditions, can contribute to the increased susceptibility to infections. If you're experiencing recurrent infections, it is advisable to consult a healthcare professional for a comprehensive evaluation. They can assess your symptoms, perform relevant tests to measure your blood sugar levels, and provide appropriate guidance and treatment if prediabetes or any other underlying condition is identified. Managing blood sugar levels, practicing good hygiene, and addressing any underlying health issues can help reduce the risk of recurrent infections and promote overall well-being. 10. Darkened skin. Darkened skin, particularly in the folds and creases of the body, can be a symptom of a condition called acanthosis nigricans. Acanthosis nigricans is often associated with insulin resistance and can serve as an indicator of prediabetes. Acanthosis nigricans is characterized by darkened, thickened patches of skin that may appear velvety or have a rough texture. These patches typically occur in areas such as the neck, armpits, groin, and other skin folds. The exact cause of acanthosis nigricans is not fully understood, but it is believed to be related to insulin resistance. Insulin resistance occurs when the body cells become less responsive to the effects of insulin, a hormone that helps regulate blood sugar levels. When insulin resistance develops, the body compensates by producing higher levels of insulin. Elevated insulin levels can stimulate the growth of skin cells and increase the production of skin pigments, resulting in the darkened and thickened appearance of the affected skin areas. Acanthosis nigricans is commonly associated with underlying conditions such as prediabetes, type 2 diabetes, obesity, or hormonal disorders. It can serve as a visible sign of insulin resistance, indicating an increased risk of developing diabetes in the future. Summary. In this video, we discuss the 10 shocking prediabetes signs that you must know before it's too late. These signs include frequent urination, increased thirst, unexplained weight loss or gain, fatigue, slow healing of wounds, increased hunger, blurred vision, tingling or numbness, recurring infections, and darkened skin. Recognizing these signs is crucial for early intervention and prevention. If you experience any of these symptoms, it's important to consult with a healthcare professional for further evaluation and guidance. By staying informed and taking proactive steps, such as adopting a healthy lifestyle and seeking medical advice, you can reduce the risk of developing type 2 diabetes and improve your overall well-being. Remember, your health matters, and by being aware of these signs, you can take control of your health and protect your future. Don't forget to subscribe to our channel for more informative content and share this video with others who can benefit from this important information. Together, let's raise awareness about prediabetes and empower ourselves to make positive changes for a healthier life. Thank you for watching our video on the shocking signs of prediabetes. We hope that this information has empowered you to take charge of your health and make informed decisions for a healthier future. Remember, early detection and intervention are key in preventing the progression to type 2 diabetes and its associated complications. Take control of your health, make positive lifestyle changes, and together, let's fight against prediabetes. Stay healthy, stay informed, and thank you once again for watching.